So the event will be a presentation followed by a question and answer session with the attendees. And so we encourage people to put their questions in the Q&A part of Zoom. I think people are really used to that now. And then we will be putting resources and things in the chat. And so that will happen as we go along. But please put your Q&A and your questions in the Q&A feature. And we will use the chat to share links, but the chat will not allow the audience to chat with each other. So let's get started. So we're really excited today to tackle this topic. And our first speaker we have is Dr. Bryn Austin. I'm really excited to have Bryn here. She is a kind of longtime colleague of mine at the Harvard T.H. Chan School of Public Health. But in her formal role, she's professor in the Department of Social and Behavioral Sciences and the Division of Adolescent and Young Adult Medicine at the Harvard Chan School of Public Health, but also at Boston's Children's Hospital. And she's also director of the Strategic Training Initiative for the Prevention of Eating Disorders, a public health incubator. So welcome, Bryn, and why don't you get us started?
Wonderful. Thank you, Karestan. I'm delighted to be here with you, a colleague for many years at the Harvard Chan School, and then all of my colleagues from around the country who we'll be hearing from today too. Really delighted to have this opportunity to share what we're seeing now in the eating disorders community in healthcare and in research. I'll give a little bit of background of the research on eating disorders, and then my colleagues here will really be able to paint the picture of what's happening on the ground now through the pandemic. So I want to say a word about Striped, the research and training program I lead. We put an emphasis on policy translation and actionable science, and I'm going to get to that a little bit later today on action that all of us and all of you in the audience can take to address the issues you're going to hear about today. The main point I want to convey is that our nation is ill-equipped to handle the skyrocketing rates of eating disorders happening now during the pandemic, and we're allowing untreated eating disorders to persist, and this is compounding health inequities. My program Striped recently published a major comprehensive report on eating disorders here in the United States. And the main take-home points here are that eating disorders are common, they are deadly, and they are expensive. Nearly 30 million Americans will have an eating disorder in their lifetime, and that's close to 9% of the US population. Black, Indigenous, and other people of color or BIPOC communities have equal or higher rates of some eating disorder types, but BIPOC individuals with an eating disorder are half as likely as white peers to receive treatment for their eating disorder, to have access to treatment. Eating disorders are among the deadliest of any mental health condition, with over 10,000 Americans needlessly dying every year from this preventable and treatable condition. And that equates to about 1 death every 52 minutes. Most people with eating disorders, though, despite the severity, do not have access to treatment and do not receive the life-saving care that they need. And the pandemic, as we'll hear today, is worsening eating disorders. And I want to call attention to one finding we're seeing in the research literature now, because we know the pandemic is worsening financial difficulties and food insecurity, especially in BIPOC communities where we see food insecurity rates somewhere between 15% and 25% of people experiencing food insecurity. We now know there's a close link between food insecurity and eating disorders and also financial difficulties. We've seen from very recently published research, community-based research, seeing higher rates of disordered eating behaviors in communities facing high financial distress and food insecurity. So this is the compounding problems with the pandemic. I mentioned that eating disorders are expensive. Our recent comprehensive report put the number at around $65 billion. It is the hit to the US economy every single year because of eating disorders. And this is on par with Parkinson's and right around the middle of what the economy experiences due to schizophrenia, another very serious mental health condition. Each year, families commit on average 6 weeks full-time unpaid informal care for a loved one with an eating disorder. So then we ask the question, why are eating disorders so deadly and so expensive? I'm going to point to one example of this, and our panelists here today are going to tell you much more about this. One example I would say is that because the point I was making about how our nation is ill-equipped now to handle the skyrocketing case of eating disorders, it comes down to, in part, government neglect. Government neglect. And I'm going to give you one example before I turn over the mic. I'm going to look at Medicare. Medicare covers 15% of the US population, 44 million people on Medicare. Expect that number to be approaching 80 million in less than a decade. Well, Medicare offers the vital health care that Americans normally have access to if they're on Medicare, and absolutely are needing more intensely now during the pandemic, especially elders, people with disabilities. Yet Medicare singles out people with eating disorders to give them substandard care. And specifically what Medicare does, I think you could really call it cruel and capricious to deny life-saving nutrition medical care for people with eating disorders on Medicare. Even though this is covered for people with diabetes and end-stage renal disease, if someone is on Medicare, has an eating disorder, they are denied the absolutely essential nutrition care. I know we'll hear more about that from the other panelists. This means 500,000 BIPOC individuals who receive Medicare and have an eating disorder. This means 4% of elders, 5% of people with disabilities who have an eating disorder receiving Medicare are getting substandard care. So I'm going to stop there. That's the background on some of the key points from the research and where we see the problems arising and how our nation is responding. So Karestan, back to you.
Thank you, Bryn. Yeah, it's a lot. I've actually, I'm learning a lot myself about this, hearing you, some connections that I had not made between food insecurity and eating disorders. Next on the panel, we have Johanna Kandel, and she is the founder and CEO of the Alliance for Eating Disorders Awareness and author of Life Beyond Your Eating Disorder. And she founded the Alliance after a long battle with eating disorders. And she's really brought a lot of attention to this issue internationally. So thank you so much, Johanna, for joining us.
Thank you so much, Karestan. And you know, it's always such a pleasure to be with such amazing colleagues and to be asked to be here today. I want to first piggyback off of what Bryn was talking about, access to substandard care. For me, and a lot of my career and the work that I've done is really to bring parity between mental health and physical health. You know, as someone of lived experience, I absolutely experienced the disparities between both and was told that just because I had a mental health illness, it wasn't on par with physical health. So that was really my first step into advocacy. I was lucky enough to work next to the amazing and groundbreaking Kitty Weston on the Paul Wellstone Mental Health Parity and Equity Act. And I just I'm continually dismayed by the fact that we still do not equate mental health to physical health. So as Karestan said, I am the founder and CEO of the Alliance for Eating Disorders Awareness. We are a leading nonprofit specialized in support, education, awareness, early intervention, and advocacy for all humans that are experiencing eating disorders. It's very important to me to share all humans because, as Bryn was talking about, so many inequities, so often people that look like me are the ones that are most often thought about when we think about eating disorders. I am a child of the 90s, and so for me, I learned all of my eating disorder education from Lifetime television movies, particularly around Tracy Gold. And as we really know is that, you know, only 6 to 7% of those who actually experience eating disorders look like that archaic stereotype. And for me, that was a lot of what motivated me to not only found the Alliance, but really is my North Star for everything that I do here with the Alliance. We know that, you know, eating disorders come in all shapes, sizes. You know, we know that they come in all socioeconomic status. We know that all sexual orientation, all abilities as well. You know, so often we don't talk about ableism in the conversation with eating disorders, and we have to. And something that has been really really shocking and then not shocking at the same time. Today is actually a year that we left our office. We have since come back, but basically the world turned on its access about a year ago this past Monday. We went from all in-person services to all virtual. And I had an inkling of that, COVID was going to make things with individuals that are experiencing mental illness more difficult. I don't think I quite understood how difficult it would be. And for us, what this translates into, we had a 108% increase in calls to the Alliance to access care last year. That is through our phone call, through our Find ED help mechanism, through emails, you name it, through smoke signals, whatever it was. We had 188,436 touch points for care. And what we've seen across the board is not only are mental health providers maxed out, they have no more room in their private practice, but treatment centers are now at these these just unbelievable wait times. I heard from a colleague at the highest level of acuity stabilization that they had 16 people die on the wait list waiting to get into care last year. That is simply not okay. We have to do better. We need to do better as far as access to care, because we know about roughly only 30% of individuals that experience eating disorders will actually get access to care. We have to do better. We have to show up. We have to arm our primary care providers on how to recognize and refer. So just because someone that lives in a higher weight body is not just, dismissed and weight stigmatized or told to lose weight. We need to let folks know that are not Caucasian, that yes, of course, disordered eating and body image disturbances and eating disorders can and do and will affect them. We need to do better, like Bryn said, where we know that folks in the BIPOC community are about 50% less likely to get access to care. And so what we have seen at the Alliance over the last year is really unbelievable numbers, but then this beautiful opportunity to show up like we've never seen before. With the fact that we were able to switch all of our services to a virtual platform, we've been able to access care or give support services to folks in care deserts across the world. The thing that I think I hold closest in my heart is we have a transgender male from Saudi Arabia who wakes up in the middle of the night to attend our virtual support groups because, number one, he cannot live as a transgender male where he lives, and there are no resources. On average, we've had about 31 countries attend our virtual support groups in the last year. And in fact, since January alone, we've had over 5,000 people attend our virtual groups. So all to say that for me, my story brought me to this place where there could have been many interventions along the way. For some of my experience, I did fit that archaic mold. For some of my experience, I didn't. And when I walked through my journey, one thing that became very clear to me is, number one, is that I do have a voice. I do deserve to be seen and heard, that we need to do better with early intervention. We need to do better with connecting folks to the proper levels of care. We need to do better with accessing care. And more than anything, we need to let people know that they're not alone and that there is help, that there is hope, that recovery is possible. Thank you so much.
Thank you so much. And thank you for sharing your story. Really, I appreciate it. And it means a lot to the audience as well, I'm sure. So next, thank you. We have, I feel like this session any of our panelists could have a whole session of their own. And I wish we had 4 hours. But next up is Monika Ostroff, who's a certified eating disorder specialist and supervisor and nationally recognized for her 25 years of experience and contribution to the field of eating disorders. So thank you, Monika. Thanks for joining us.
Thank you so much for having me today. And I just want to echo a lot of what Johanna said. I'm really delighted to be able to be here talking with you all with such incredible colleagues from all over the country. What an amazing opportunity. For people who might not be familiar with me and with Meta, I'm actually a professional with lived experience. I'm recovered from a severe and enduring eating disorder. And similarly to Johanna, had a heck of a time accessing services and care. My eating disorder was severe enough to land me on disability, which meant that I have Medicare. And so, as you already know from Bryn earlier, that meant that I was not privy to services from a dietitian. So you can imagine that made my struggle to get better a whole lot harder than it probably had to be. So like my colleagues this morning, my own experience of discovering that, my goodness, recovery is both possible and attainable, as proven by our own lived experiences here today, that motivated me personally to get involved in the treatment side of services for eating disorders. So my background is that I have opened and led 3 of the 4 eating disorder treatment centers in the state of New Hampshire where I actually live. And my career has actually come full circle by being able to be the executive director of Meta, which is located just outside of Boston. So Meta was actually similar in many ways to the Alliance, was founded in 1994 by Becky Manley, who's also recovered and wanted to get the word out that, hey, once you have an eating disorder, you don't always have to have an eating disorder, which used to be back in the 90s what everybody was told. And so she founded this organization that it's so strange that I've been able to be involved in since the 1990s. We volunteered together for another organization before Becky founded Meta, and then I was able to volunteer for Meta and provide some consultation. It turned out to be the first national conference that I'd ever spoken at back in, I think it was 1998 or 97. So access to care is really at the crux of what we do at Meta. And so I'm going to tell you a couple of different things today. So Meta provides direct services to people who are struggling with eating disorders and their families. So we do full assessments and level of care assessments to try to figure out what level of care people need. And then we connect them if you need residential or inpatient or partial hospital levels of care, for example. But we also provide individual therapy, group therapy, and family therapy, as well as coaching and skills sessions for folks. Well, I'll tell you, and I'm going to tell you a little bit about education and training in 1 second. A year ago, as Johanna said, when she said we could not possibly have envisioned or imagined the need that came as a result of the pandemic, truer words have never been spoken. We saw a 500% increase in our call volume from January to January, and almost a 700% increase in just individuals coming through our virtual door. We had to pivot like the Alliance did in a day. There was a 24-hour period where we went from people coming into the office to, we're going to do everything on Zoom now. And it's been amazing and heartbreaking, I think, all at the same time. You know, then the vast number of people in need is unfathomable. You know, every provider that I know is full with wait lists. I know Joanna and I have been problem solving with our own organizations and together, like how do we get more care to people? How do we provide more services? We have actually doing some things on Instagram Live. We have Wednesday nights, we have 600 people showing up for recovery conversations, you know, and is that treatment? No, but it's helpful. It's information that wasn't getting out there to people before. The drop-in groups are always full. It's amazing. And like Joanna, we went from, you know, sort of seeing people in the Boston area to seeing people from Brazil and the UK and South Africa, people from all over the world also joining us looking for services. It's become an incredible opportunity. We have an educational arm. We do a lot of education and prevention, where we tailor services and presentations to schools and community organizations, but also providing training to professionals to ensure that they have the latest information on efficacious, evidence-based treatment modalities to use with their clients and their clientele. And we have seen, you know, we actually do take most major insurances, and we give a lot of scholarships for care. We see a lot of folks on Medicaid, lots of people on Medicare. We accept Medicare actually as insurance. But, you know, the struggle that both Joanna and Bryn referenced earlier in the BIPOC community, the LGBTQIA community, and folks in lower socioeconomic statuses is really challenging. All our staff has gotten really great training in diversity and inclusion. We are HAES aligned, which is health at every size training that is really inclusive of people living in larger bodies to really fight for and ensure equity in healthcare and mental health care. But you know what's really hard is that people, BIPOC community and LGBTQIA would love to have providers who self-identify in their communities. And it is so hard to find that. It's no secret, you can all see I'm very white and cisgendered, you know, and I have information about helping people to recover, but I'm not self-identified in those communities. And it's compelling, the need for that. And I think we're all trying to also put our heads together to figure out how to get more people in those communities providing services for these folks. So I feel like I went a little bit all over the map for you folks today, but the need is just incredibly colossal. And watching people come out and the numbers increasing every week who are coming out for events is really proof of that, you know. So thank you.
Thank you so much, Monika. Yeah, it's really, I mean, the statistics that you're citing about the number of calls and, you know, pressed also by the global reach of the virtual events. I guess we've all seen that, but the example Johanna gave about the person in Saudi Arabia waking up in the middle of the night to join a group, it's really, yeah, very startling. And so, last for this portion to talk about her work is Dr. Lesley Williams, who's a board certified family medicine physician and certified eating disorder specialist. Lesley, thank you for joining us, and looking forward to hearing from you. And then after this, people have been putting questions in the chat. We will post some questions to the panelists, and people can also, the audience can ask questions. So thank you, Lesley.
My pleasure. Thank you so much for the invitation. And it's so wonderful to see everyone here this morning and all of my great panelists. So just a little bit about me. Yes, my training is in family medicine. I came into this eating disorder work mainly because of curiosity. I had seen how disordered eating had really impacted friends and family members and rarely saw it talked about, particularly in the Black community in terms of its root causes or even really identified as an eating disorder. And so that was my initial attraction to the eating disorder field. And once I entered it, I did inpatient work for over a decade and really noted that I was a unicorn, if you will, within the field. There were very few people that looked like me. And oftentimes when we had patients that came from marginalized communities, the treatment team was at a loss as to how to incorporate that into their care, even though as someone who identified with them and with their struggle, I recognize that it's often very central to their experience and what may have been a catalyst to their the start of their eating disorder. And oftentimes what I saw played out within the treatment setting or even in seeking out treatment was the fact that it really recreated some of those racial inequities that may have, again, been the catalyst of their eating disorder in the first place. So I really felt the need to try and figure out a way to bring treatment to a wider audience. And so that's where a lot of my work has been, and also trying on the prevention piece. I think if, reaching children at a younger age and discussing some of these issues in terms of body dissatisfaction, particularly for Black girls, from their hair to their skin type to their body shape, really trying to work from that prevention standpoint. Of course, now that I am a mother and I get to see it real time in the younger generation, has definitely been an area of interest for me. And what I have seen over the past year since the onset of the pandemic has just been startling in terms of how, in particular, marginalized communities have been impacted. So you can imagine that you take a community that is all of a sudden inside the house. We have had much more insecurity in terms of, maintaining housing, maintaining food. And on top of that, you add to it turning on your television every day and being constantly inundated with all of these images of what was happening in terms of racial inequity from the justice standpoint. And that's something that you're home all day, every day, and that's what you have to look at on the television. And then you don't have your normal social outlets to be able to really talk about and decompress and deal with that. And it really just created, just this powder keg, if you will, for eating disorders that maybe had been there previously to really explode, or maybe set the stage for eating disorders to really just take root. And so a lot of the phone calls that I would get are from patients that maybe had been in recovery for a long time. And now, I'm completely stressed. My mom is living with me. I have kids home from school that are being homeschooled, women that are the primary caregivers for their household. And I don't know how long I'm going to be able to maintain this job. Every time I turn on the television, they're telling me that I need to go out and buy all this food and have all this food constantly on hand. And add to that the fact that I have family members that are sick and dying. Most people that I know have been directly impacted by COVID with deaths in their family. I myself have had to deal with that. Young people in my family dying of fear of going outside of the home because of the potential impact that it would have. And then it just really set the stage for what we've seen and what we've heard today in terms of just people being inundated with an increase in terms of eating disorder struggles. And so I think that I'm excited about this conversation, just an opportunity for us to kind of dig deeper into that and really try and kind of look at ways that we can be allies and advocates in the future. I appreciate the fact that with everything that has transpired over the past year, there has been more emphasis on some of the health disparities. And that's where a lot of my advocacy lies, is in this idea that we need to increase access to care for all people. I know when I first started out in eating disorders, oftentimes I would have BIPOC individuals come to me seeking care. More frequently, they were maybe in the normal to higher range of BMI, and they had often been told that if you want any type of treatment, the option that you have is to get your weight to a point where you qualify for gastric bypass. And once you qualify for gastric bypass, then your insurance will allow you an opportunity to have nutrition care and all of these other things that are not available to you currently. And the way that we currently provide eating disorder treatment really is somewhat limiting, because as I just mentioned, some of these multi-layered social issues that disproportionately impact the BIPOC community make it such that eating disorder treatment, which oftentimes requires finances, we talked about how expensive it can be, certain insurance coverage, time away from work. Most people cannot afford to take time away from work to have intensive treatment. Support from your family and from your community. Oftentimes, eating disorders are not recognized or well understood. And so you don't have that family support where the whole family is kind of rallying behind you to be able to provide everything that you need to be able to get that specialized treatment. So it's not just the money that is a hurdle, but there's a lot of other multi-layered hurdles that make it difficult. And then you add to that the fact that when they go to seek treatment or really even evaluate whether or not they have a problem, oftentimes the providers that they encounter do not look like them, or often kind of disregard their issues, because in their mind they have maybe some implicit bias and just can't envision that this person in front of me could represent, what I've been told historically an eating disorder looks like. So that's just kind of a little bit about me and what I hope to bring to the discussion today. And I'm just happy to be here.
Thank you so much. That's terrific. And like I said, I'm learning a lot here too. I mean, my specialty area is on trauma and post-traumatic stress disorder, which has intersections with this, but there was a lot here that people spoke about that I wasn't aware of. So I have a couple questions, but there's also amazing questions in the chat. So one of the questions we've been wondering about, and you've touched on this, maybe you can expand on it a bit, is COVID has led up to a lot of changes in daily living habits and all kinds of things, like Lesley just talked about. And how have these affected disordered eating? And there's a couple questions in the chat around the different eating disorders and whether unhealthy eating is a disorder. And so maybe trying to break this apart, someone could start answering sort of how some of the different aspects of COVID and also the like sort of, I guess, awakening and for some people around racial and social justice issues in this past year, how that have affected the different manifestations of eating disorders for people, and also perhaps around issues of people who were at risk maybe starting an eating disorder versus people maybe who had recovered and then relapse. I guess you use I don't know if that's the language people use. So I realize I put a lot there. I know, Lesley, you just talked, but I don't know if there's anything there you want to touch on or someone else wants to jump in.
I can just briefly state that, as I mentioned, the idea of being at home, having a lot of those coping mechanisms removed. Also, at the beginning of the pandemic, if you guys recall, every time you turned on the television, they were saying, if you are fat, if you are Black or brown, you are going to die if you get this. And so just imagine what that's like if that fits your description or your family members. It took the fear around COVID to a whole nother level. And it also took a lot of the kind of social lens in terms of blame. Right? When you heard that someone had COVID, it was kind of like, well, did they have an underlying condition? Were they, what was their weight? It was kind of like it put personal blame on people for getting sick and dying of this deadly illness. And then you add to that, as I mentioned, some of the issues that we were dealing with in terms of social injustice, seeing that on the television and the stress level that goes along with that in terms of when you did leave your house, I myself not knowing what you were going to encounter out in the community. So there were a lot of stressors that came out of this past year that really set the stage for disordered eating or, insecurities around that. And a lot of it was intertwined not only with the COVID pandemic, but also with some of the social issues that were happening here in the States.
Yeah, thanks, Lesley. I don't know if Johanna or Monika want to talk about how maybe things that you observed, especially when you have these call lines and people calling in around.
Sure.
Yeah.
Yeah, I'll start, and then Monika, I'm sure we're going to talk very similarly. One of the things when my clinical director first came to me and said, like mid-February, hey, Johanna, we really need to think about how our psychological services program, we have here in South Florida, we have the first of its kind. It's a community mental health clinic that we offer very low cost outpatient care to folks that are underinsured or uninsured, individuals that have never had access to care, and they pay between $25 and $5 a session. And in fact, even in this last year, we saw almost a 41% decrease, in what people have been able to pay for their services because so many have lost their jobs. But she came to me and she said, we have to start thinking about what's this gonna look like if we have to pivot very quickly. And I sat in this office and I said, it's not gonna happen. We're not gonna worry about it. No worries, it's all good. And literally, just like Monika shared, a year ago, this past Friday, we started hearing across the country that our support group locations were closing down, and we needed it to close down. And so we pivoted very, very, very quickly. But all to say is that all of a sudden we heard from our community, oh my gosh, that support, that connection that we count on so much. And, eating disorders are very isolating, very secretive disorders. And so one of the things that we really tried to lean into is that, yes, you might be physically distanced, but you're socially still connected, and really focusing on that, and I think alongside this collective anxiety and, Karestan, you talked about, folks that were in, a really great recovery and then were relapsing. I heard that across the board, people that had real secure recoveries. And I will fully attest to, as someone who has experienced an eating disorder, my eating disorder was certainly not alone in the car. For me, it was generalized anxiety disorder. And my anxiety that I thought was, we were cool, we were great, like for decades, all of a sudden I was going to bed at night crying, thinking I was going to stop breathing because my anxiety was so bad. And it was really humbling for an individual in my privileged position that, runs an eating disorder organization that does now, as opposed to before, have access, to care, but also didn't want to break that illusion that I had everything together when I was suffering. And so very quickly, I started using my voice and saying, I know that I'm having a hard time. It's okay for you to say that you are having a hard time too. So I think that with everything that was happening with COVID, with the food scarcity, for example, too, you talk about, Lesley, you were talking about the beginning of the pandemic, like, yeah, we all joked around about toilet paper, but all of our aisles in the grocery store were empty. And so this feeling of trying to grab as much as you can, and then for individuals that might have a harder time with binging, then being in a home with all of this excess as well. And then the last piece I just wanted to put on to add to that was then this message that you're a home and you need to do all of this. Like, not only do you need to do your job and teach your kids and do all that, but then we're also going to tell you to be careful about the quarantine 15 that ran bid throughout. And then we're going to have you do the push-up challenge as well. Oh, and then by the way, you're going to Roy G. Biv your closet from the home edit, in a rainbow, as well as this Pinterest beautiful, you can work, you can do this with your kids, and these unrealistic standards of how we needed to show up. And so this reminder that needed to be happening is that you're not on vacation, you're surviving a global pandemic. So I think when you add all that, plus everything that we were seeing on TV, like Lesley was talking about, of course, individuals were having a collective difficult time. I'm not sure, Monika, if you wanted to hop in as well.
Yeah, just a couple of things to help unpack with that. Your point, right? Like, your eating disorder wasn't alone in the car is so true for, I don't know many people, if anybody, that has just an eating disorder. So, certainly the anxiety that came along with the pandemic has brought us to this level of global anxiety that I don't think any of us have ever seen before in our lifetime. And if you didn't have PTSD before, you probably do now. And eating disorder symptoms have a way of serving people to mute or modulate their emotions. So we see this increase in eating disorder symptomatology as a way of managing a lot of their co-occurring disorders in a time when it's really hard to get yourself into therapy because everybody's practice is full. And, it's very true, Joanne, both of you actually touched on this, right? That eating disorders thrive in isolation, and the pandemic created fertile ground for eating disorders to sprout, grow, intensify, or regrow in the case of relapse. At the same time, oh, well, and I should add, at the same time, lots of folks were finding themselves stuck at home living with very triggering family members. So that $72.2 billion diet industry is in the heads of lots of folks that our clientele lives with. And they're getting continually triggered by the things that their parents and their siblings are saying. And then they log on to the internet and they get more triggering information. But I have to say, I have never been prouder of being part of this profession than I have been in this last year, because every single eating disorder professional that I know, including the ones that are right here today, saw what was happening. And we came together in ways that we never thought we could. There was, within days, an Instagram account that was created called COVID-19 Eating Support. And we all pitched in and volunteered our time to have supported meals and snacks around the clock for 24 hours. We had people in the UK and Australia. I gave some time every week. So many of my colleagues did, and we just kept showing up, and our clientele was showing up. And it's just exactly what Joanna was saying, where you might be physically stuck someplace, but you can still be connected. You can still have hope, and you can have resources. And sometimes for the first time, I think we've all heard people say, oh my gosh, I know this sounds terrible, but pandemic's the best thing that's ever happened to me. I actually have access to support and care and information that I've never had before. And that is a really beautiful thing to be part of. I think it's tragic that it took a pandemic to get us there, but maybe we can carry on with that and really transform care and make it inclusive of all bodies, all races, sizes, and genders, which is not what we had before.
Thank you. Bryn, I had a question for you, but did you want to jump in here? And one of the questions I was going to pose, just to maybe, because of the area you work in, is there's a bunch of questions that the audience are posing about particularly adolescents, home with adolescents, seeing adolescent kids have eating disorders who don't see they have a problem, or when do you start talking to adolescents about it? So I know you work with adolescents and pediatrics, so maybe.
Yeah, I would definitely refer folks to check out the resources that Johanna Kandel and her colleagues have posted in the chat, and Monika Ostroff has posted, and others, for where you can tap into existing groups or guidance around how to talk to your children, or how to help children get into treatment when they need it. So they have incredible resources. I do want to make sure we get back to solutions. This has been a really heavy, difficult conversation so far that really needed to happen, but I don't want to leave people with just that. So Karestan, when you're ready, I know several of us have some great solutions for how the audience can get involved. And I know we even had a question about that.
Yes.
One word, I saw there was a question about where to get training as a healthcare provider to do screening in primary care. So I'm going to post in the chat a free brief training that my organization Striped has on our website. It's just an hour, and it'll give you the basic 1-2 on what you need to do as a primary care provider to do screening for eating disorders in your practice. Karestan?
Great, thank you, Bryn. So let's I know I always want to dig more into the problem, but that's my researcher hat. But I agree. So one of the questions I wanted to put out there, maybe Bryn, if you want to start with this, is have there been any developments, especially during the field that's come across during this time of COVID, that you think will stand the test of time and help us better address eating disorders? Like, what are some solutions that maybe you wouldn't have thought of before, or that have become particularly, areas that you want people to be particularly focused on or active in to address these issues as we emerge from COVID?
Well, I think two things come to mind for me. One of them affects across mental health, and that's telemental health. Before the pandemic hit, there were people who were advocating for access to mental health care, whether within your own state or across state lines, for people who, for many reasons, it could be barriers, even if they're in an area with a lot of services, or it could be barriers to accessing eating disorders care, which isn't in somebody's area, or in rural areas across the country where you could drive 6 hours and you may not still be able to access care. Telemental health has just wiped that away in terms of the physical distance between people needing care and in care for treatment of a full-blown eating disorder, but also the kind of care people need to stay on a healthy path and avoid developing an eating disorder. That's one piece. Another piece that I want to get to, and Johanna mentioned this very briefly, and Lesley, is weight discrimination. We saw that Lesley made the point that the news coming through the pandemic day after day is, if you're Black, if you're another person of color, if you're fat, as she said, you're going to die, you're going to get COVID. And then there's the blame on individuals. Well, that weight discrimination really came to the fore in those attitudes about people and body weight through the pandemic, and communities have crystallized advocacy around that more to put those discriminatory attitudes, that bigotry, how it's barriers to care, it's blaming of individuals, and is not taking responsibility for what's happening in our environment where there's discrimination that has to be addressed. I would say that's something that has become even more clear during the pandemic. We need to continue that work to address weight discrimination. And then on the first point around telemental health, make sure that when the pandemic ends, that doesn't all go away. We've got to keep that going.
Go
ahead, Lesley. I was going to, yeah.
Yeah, I was just going to say too, back on that point of telemental health and telehealth in general, is that historically the idea of like having access to that, a computer and all of that, was again seen as a luxury and something that wasn't necessarily available to the population at large. But I think what we've seen in terms of over the past year during the pandemic is that it really is essential. And so there have been a lot more efforts made to get devices into the hands of those that maybe don't have regular access, because now their kids, that's the way that they access school or other things like that. So I'm hopeful that we will continue in that direction, is that having access to technology is something that's available to all people and that it's not just for the distinct few, because having telehealth is great when everyone has an ability to access it. But it's less helpful when you have people, based on their socioeconomic status, their age or whatever, that don't feel comfortable interfacing with the medical community in that way.
Lesley, I absolutely, yes. And the one thing that I just wanted to circle back to your original question of what you hope to see. I mean, absolutely, Bryn talked about teletherapy, which is something at the Eating Disorders Coalition we've been very engaged in ensuring that it continues. The other thing that I know that for us at our organization, and I'm sure Monika is seeing this as well at Meta, is we never conceptualized virtual support groups before this. Like, it wasn't even in our bandwidth, in our wheelhouse. There's not a question that we're ever going to go back to not doing it. So for us, it's this ability to learn this hybrid model of, absolutely, when it's safe to, continue to have our 21 in-person support groups across the country, and also continuously adding virtual services. Even like at our psych services, for example, it's going to be a hybrid because, you talk about lack of access. We don't have the greatest public transportation system in South Florida. I mean, it's pretty terrible. And so literally we would have people on the bus that would spend 2 to 3 hours going 15 minutes to see their clinician. So, having this ability to say, okay, we can do this hybrid model of perhaps maybe we do virtual sessions, 4 to 5 times, and then we do an in-person session as well. So I think that, the silver lining, if we choose to look at it that way, which I do choose to look at it that way, is just learning all of this information that there is other ways to be able to provide access to folks. Bryn was talking about, rural areas. I live in Florida, and, our state is huge. I always marvel, like, at the Northeast, where you can drive for like 2 hours and be in 3 states. Here you drive for 7 hours and you're still in Florida, pretty much. But if you're not in like the heavily populated cities in Florida, there are no clinicians. So, we have people in the Panhandle that there is one clinician that works with eating disorders. So the beauty of this past year is now it's opened it up to the state. So, hopefully that, to echo Bryn, that continuation, as well as learning this new hybrid model moving forward, with also, being very mindful of how are we going to continue to give folks access to computers, to Wi-Fi's, to all of that. But I'm actually very encouraged. And I will just finish up by saying this is, I think this is a beautiful explanation. Bryn and I share this love of, this is why our voices matter. If we've seen this in surveillance, we've seen this in other ways, that if we don't use our voices to say this is a really wonderful addition, those are going to go away. And so when you see this opportunity, I know that the coalition does phone to action, and they send out action alerts all the time. We're urging your members to fight for the continuation of telemental health, fight for surveillance, fight for so much, fight for the necessity of medical nutrition therapy in the treatment of eating disorders. Because as I say to my members all the time, have you ever tried driving a car with 3 out of 4 tires? You're not going to really get anywhere. And us expecting not to have access to the all necessity of care for the treatment of eating disorders is not going to get us anywhere. So I cannot say enough for anyone who's on this is to reach out, get yourself involved with the Eating Disorder Coalition's phone to action. Our voices matter, and use them. For more than a decade, I felt like I didn't have a voice. I felt like I didn't deserve to be seen and heard. And, we do have this amazing privilege of using our voices, and collectively, I know very well that sometimes, like, because I do have luxury and I do have privilege, I need to extra use my voice and make sure that I'm bringing other folks, lifting up other folks, and passing the mic for other folks as well.
Thank you so much, Johanna, for mentioning that, and the Eating Disorders Coalition. I just wanted to come back to that point and let the audience know about an opportunity where you can raise your voice, make it heard in the halls of Congress. I mentioned early on the problems with Medicare and the substandard care for recipients of Medicare, where they can't get nutrition care access that is basic and life-saving that they need to have. Well, the good news is there's actually legislation in Congress right now to fix that. And it's a bill, the Nutrition Care Act, that's being considered right now. In fact, there was testimony on it yesterday in Congress. The Eating Disorders Coalition, which is the major federal advocacy group educating the federal government around eating disorders, on May 6th is having the next virtual advocacy day. So it's the EDC advocacy day. It's all virtual. You can stay at home and do it, or stay where you are. Don't have to travel to Washington. The information about how to sign up is in the chat there. Now, what we're going to do with this legislation is fix this problem so that people with eating disorders on Medicare can have the same nutrition care access that others do, like for diabetes or end-stage renal disease. It'll be life-saving. And as Johanna said, and everybody really has said, how overwhelming it can be to feel as an individual, can I really do something that'll make a difference? The answer to that is a resounding yes. Join us at the EDC Advocacy Day on May 6th. You'll see the information in the chat. Make your voice heard, and you will be saving lives.
Thank you, Bryn. And yeah, look in the chat because all this information is there. And I especially appreciate that because I think this is a time when many of us can feel pretty powerless, basically still told to stay home. And this is where we really can make a difference because it's clear that we have to have these policy changes. It can't just be on individuals or even individual providers or organizations. We definitely need these systemic changes. So I don't know, Monika, if you wanted to jump in, is there anything you were thinking about what folks were saying?
Yeah, I just wanted to add two things. I mean, absolutely supporting people getting involved, especially in EDC's Advocacy Day. The call to actions are so important. If you're not on our mailing list, to get on the mailing list for Meta, the Alliance, Striped, and you'll hear about those will come right into your email box to be able to have a voice and really drive this change forward. I think too that it is going to be important to be very vocal about wanting to hold on to and keep the platforms that we have in order to promote access to care. I agree with Johanna, you can actually be in 3 states in a couple of hours in the Northeast. Geographically, we're not a lot different. We have a lot of areas that are very rural where people can't access care. I've seen that my entire existence, especially living in New Hampshire. I live in southern New Hampshire. Folks up north can never get care. So this idea of making sure that we can keep these telehealth platforms, and there's some other advocacy work I think we're going to need to be doing around interstate licensing so that we can make sure that people have access to what they really need. But I also wanted to mention for folks to just sort of stay tuned over the coming year. Meta's rolling out a recovery community, and the idea for that recovery community is actually, you think about kind of like a self-help, self-serve, on-demand access to things like video courses, downloadables, meditations, webinars, et cetera, that people can just kind of access even if it's in the middle of the night. We find sometimes symptoms tend to rear when people are tired in the evening, and of course providers are not generally available at 8 p.m. So it's something that people are going to be able to access free and low cost that is already in process, but we'll be rolling out throughout the course of this year as a way of not replacing care, but hopefully helping you stay steady while you're getting into care and augmenting the care that you do have.
Thank you. Again, I'll keep saying, let's check out the chat because all the resources are in there to the audience. And this will be posted online in case people feel like they missed something someone said. It will be captioned, so you'll be able to go back and see this again. But another question I wanted to throw out there was a lot of things in the Q&A about this, about social media and also about culture change. So we talked a little bit about the changes in care and in policy, but what is there a role for social media in changing the culture around this? And do people want to comment on that? I've been thinking a lot of that related to mental health broadly myself. I don't have any solutions, but any thoughts? I don't know. I see Lesley nodding, but anyone can jump in. So
I definitely think there's a role for social media in terms of like advocacy and change for the future, I know that that's definitely one of the tools that I encourage patients oftentimes to use, is to look at the images that you're getting on a daily basis and how much are they fortifying you versus making you more vulnerable. And if they're not fortifying you, you can be very intentional about what you expose yourself to. So if you're out there kind of seeking out groups that encourage body positivity, that encourage recognizing when there's mental health issues and supporting one another to get extra help. You can just really be intentional about the images and the access that you have, and limit some of those things that, it was mentioned earlier about, seeing all of these different sites that are telling you you should be making perfect meals and your children should be perfectly behaved and you should be, an ideal teacher, and all of these simultaneously. I got rid of all of that stuff. I don't need to see that because that's not my reality. And constantly being inundated with those images is making me question, my reality, when in fact I'm surviving in the midst of a pandemic with 3 young children and being a working mother and wife. Like those are the people that I want to hear from and work with in terms of navigating this difficult time. And so I think that it really can be a tool, not only what you exclude, but also what you include in terms of your daily images, to really help support people and fortify the fact that you're not alone in this struggle.
I think those points from Lesley are really critical for working with young people, working with people of all ages about how to manage the social media exposure, where there's such big quarters of social media that are a toxic environment and they're dangerous in the exposure. But taking a step back, we also need those conversations with the platforms. And that's where, with our group Striped, we've been in conversations with some of the platforms and doing research around, well, how do those toxic images and messages get to certain users? It is not by accident, and it is not user produced. They write algorithms. The algorithms prey on people. These are predatory algorithms that target people for all kinds of reasons. We've seen a lot of exposure recently over the past year of racist algorithms that end up perpetuating structural racism around housing and employment and other things. Well, they also have algorithms that are written to send these kinds of toxic messages to people with eating disorders, people who seem to have symptoms of vulnerability around body image, body dissatisfaction, so that the ads for noxious diet pills that nobody should use, or the influencer posts before and after with weight loss, that stuff is being sent to people deliberately through these algorithms. And that's where we need to be sitting down with the platforms, the people who control these patterns, to make change.
And dovetailing off of that, I think in the interim, it's really important for people to be proactive. If you are getting inundated with some of those messaging, it is absolutely about curating your feed to make sure that you have safe content and seeking out information. But it's also about blocking and reporting those ads as being damaging. So the algorithms are also formed in part by user feedback. So the more people that are blocking and reporting that content, the safer we're going to make people's feeds. Because I think it's going to take us a little bit to get into those platforms. They're making a lot of money off of them, right? And when you think about it, I believe the latest statistic is they estimate that we are exposed to between 6,000 and 10,000 ads every single day. It's a whole lot of ads. So the things that you folks can do that are all listening really is, when you see that stuff come up in your feeds, block and report, and then specifically go seek out content that is reliable. Go to the Meta page, go to the Alliance page, go to Lesley's content, go to Striped. There are definitely people that are reliable. If you look at people that are in your area, even who are eating disorder professionals, seek out their social media platforms. Keep yourself safe and informed.
Monika, I was just going to share that as well, is go to all the pages and see who they follow. You know, and the one thing that I learned in this pandemic is there were people that I followed that felt really safe and fine. They turned out to not be safe for me, where I was specifically. You know, I mean, I joke about it, but like for me, like around this, you know, I still have much of my, you know, parts of my eating disorder that tells me that I have to be all or nothing, black or white, like, you know, and be all things, do all things. And any of those individuals who I followed, I actually unfollowed. Mute is a very okay button to do. Curating your feed is really okay. And also, you know, remembering that, you know, social media is a highlight reel. And that's really what it comes down to. This weekend, there's a new documentary on HBO called Fake Famous. And I watched that, and I very much encourage anybody to watch that, about how social media really is done. And, you know, again, is really follow people that fill your cup. Someone who is my go-to is Morgan Harper Nichols. Every day I look at her work every single day. It's inspirational, it's aspirational, it makes me feel good, it's grounding. And, you know, it's really this learning curve of, you know, we cannot block out all, I mean, I'm sure you can, but for many of us, we can't block out all social media, because for many of us, that's where we get our care and support, like the 24-hour meal support, like, you know, eating disorder organizations, Striped, Lesley's page, all of that. But, you know, putting a timer on your apps, that has been super helpful for me too. Taking off certain apps off your phone. I know that for me, when my anxiety was at its highest on Facebook, I removed the app off my phone, so it wasn't an automatic. So putting a lot of these, you know, safety mechanisms in place. Her name is Morgan Harper Nichols. She is an amazing poet and illustrator, and just is a tremendous human to follow, and fills my cup so much.
Thank you. We are out of time. I can't believe it. I wish we had another 3 hours, although I'm sure our panelists have a lot to do today. But thank you so much. Thank you, Bryn, Monika, Lesley, and Johanna, so much for joining us. Thanks for the participants and for all your questions. And I'm sorry for those we didn't get to. People were asking. We are going to get the this video captioned, and then it will be on our Population Mental Health Forum website. It also goes in the Harvard TH Chan YouTube channel. And we will, there's been a bunch of requests in the chat for us to compile some of this information and send it out on the email. So we will, Zach, we will work with the folks on this to do that, to make sure that the resources are connected to the video, but also we put them out. So thank you so much. And everyone have a great day. And again, I really appreciate all the panelists' work. Thank you.
Karestan.
Thank you.
Thank you. Thanks
Population
for
Mental
doing
Health
this.
at
Take
Harvard
care.
and all
Yes.
the panelists.
Thank you. Bye-bye.
Thanks so much.
Bye.